Hi there, this is Dr. Carmine Esposito at All Creatures Animal Hospital, and we're here today to go over some general points of diagnostic imaging for your cats. I have Mackenzie here, who's going to be my assistant to ask some questions to help us find out a little more about our diagnostic imaging modalities.
Dr. Esposito, what is diagnostic imaging and why might my cat need it?
So diagnostic imaging helps us see inside our cat's bodies. When we do a physical exam, we are able to put our eyes, ears on our cats and feel what's going on and hear what's going on the outside, but often there's more going on inside that we need help seeing.
What are different types of diagnostic imaging used for cats?
So for our cats, we have several modalities available. Today, digital x-rays and ultrasound are probably the most common modalities that we see. Certainly more advanced imaging like CT and MRI are also available. Also, there's endoscopes to help us see inside the GI tract, and there's laparoscopes that can help us see inside body cavities as well.
How is diagnostic imaging performed on cats?
So for our cats, it depends on the modality being utilized, and it also depends on the behavior and anxiety of the cat. Most of our cats can have radiographs and ultrasound done without sedation. If they're anxious or painful, then some light sedation may be required to get good images. Most of the imaging, like taking pictures with your camera, it can't be moving or shaking. If it moves or shakes, we'll get blurry images. So if the cat is unable to sit still for us for the images required, then a light sedation would be required. CT and MRIs do require sedation. They absolutely cannot move as they go through the tubes for that imaging. And laparoscopes and endoscopes also required sedation for those procedures.
When is diagnostic imaging recommended for cats?
So there is a lot of possible reasons to image our cats. It can be from trying to figure out why our cat is sick. So we may have had a cat that's coming in that's been coughing or has a distended abdomen that we're trying to figure out why that's going on. So it could be for illness, trying to figure out our diagnosis and gain more insight into why we're presenting the way we are. It could be for some healthy reasons. An example of possible healthy reason to do some imaging is a pregnant female. If our cats are pregnant, we may want to determine if the fetuses are viable. So ultrasound could allow us to look at the heart and see if the hearts are beating. We could determine a heart rate on them, so that's good. If we wanted a kitten count, we may do radiographs at a certain point in the pregnancy so that we can count how many fetuses we see. So it could be for sick reasons, it could be for healthy reasons.
Is diagnostic imaging safe for my cat?
In general, our modalities are considered safe. Yes, all of them, MRI, CT, radiographs, and ultrasound are all considered to be safe.
How can I prepare my cat for diagnostic imaging?
The big thing most of us require is the cat to be fasted. Certainly we would like for ultrasounds, CT, MR, anything that would require sedation, we would like them to be fasted if possible. If it's a planned procedure, that is nice. In a more urgent or emergent situation, we can move forward with the modalities without fasting them.
How quickly will I get the results for my cat's diagnostic imaging test?
It'll depend on the modality. Radiographs, usually we can get the results immediately. Ultrasound also, if that's available in the hospital that you utilize, then results sometimes are available immediately. CT and MRIs tend to be more of a specialty imaging modality, and we tend to send those to specialty centers, all of which currently imaging can be sent off to a radiologist to be read and get a report from a boarded veterinary radiologist. If that is chosen as an option, sometimes that takes 24 hours to get the radiologist report back.
How often should my cat undergo diagnostic imaging if they have a chronic condition?
So this is a very open-ended question. It'll depend on the condition itself. Some imaging is a one-time modality. It's done to determine the diagnosis, and then we move on to treatment. But other things that are more chronic or should be tracked a little better could be something like an echocardiogram to monitor a heart that has a heart condition. Often those like to be monitored every 6 to 12 months for progress. It allows us to adjust medical treatment based on what we find out from the echo.
And can diagnostic imaging be used to monitor the progression of a cat's disease?
Kind of like mentioned last question, like an echocardiogram, yes, there are diseases that can be monitored with imaging. It just depends on what medical condition your cat has, and up to the clinician that's managing the case on how often we should be looking at the progression of it to allow us to adjust treatment protocols. As always, this is just a general overview of imaging modalities. There are many more questions and much more nuances to these modalities. If you have questions about these, please call us at All Creatures Animal Hospital. We're always here to help and try to answer your questions. Thank you.